From isolation to misinformation to unemployment, during COVID, the mental health of Canadians has been affected negatively for going on 19 months now. And let's be honest, we aren't going to all snap back once this pandemic is over. So during this election, we've heard of talk of 10 sick days from the Liberals and the NDP. The Liberals and Conservatives also pledged to increase provincial transfers for mental health. Most plans have been a bit light on details. So let's go to our experts and what they think we need to be seeing. So Dr. McKenzie, where does the money need to flow and who really needs to be prioritized when it comes to mental health?
We had a mental health crisis before the pandemic, and the pandemic has made it worse. As you said, COVID itself causes mental health problems. Physical distances and lockdowns increase their depression and anxiety, and the economic impacts have increased stress. The way forward, however, is to protect people's mental health as well as increasing funding for mental health services. And so that means we need to look at what makes people stress. We need to look at housing. We need to look at evictions. We need to make sure people have good jobs and sick days. And we need to focus on hard-hit groups like racialized groups, Indigenous groups, LGBT groups. And this is not something that can be done by the feds alone. And that's why some people have called for a mental health social contract with the feds, the provinces and the cities, the third sector and industry all involved in building a new 10-year plan to rebuild our mental health.
10-year plan to rebuild our mental health. All right, Professor Hardcastle, let's think about the difficulty that may lay ahead for the federal government, whoever comes into power, because really it is the province that ends up delivering these kinds of programs. So what do we need to see here?
Well, I think that we'll need to see the feds work with the provinces to implement any sort of funding arrangement. And I think some of the premiers are happy to work with the feds, depending who they are, and others have been resistant in the past to conditional transfers. And so that may be a barrier to the uptake of whatever program whoever comes into power wants to implement.
Dr. McKenzie, I'm just going to go back to you. You know, we're talking about how mental health, the economy, but it's also about racialized communities, and we've been talking about, you know, universal health care, basic income and things like that. Is that something that's going to be pressed upon to have shelter and food and all those things that really do help with mental health?
Yes, most definitely. The social factors that keep you well, 85% of your risk of illness is linked to social factors. And so if you can improve things like housing and look at evictions, if you can look at things like the basic income, you can improve health. In fact, during this pandemic, there is evidence that the CERB protected the mental health of people who are unemployed. And so though we always think about increasing funding to provinces to build mental health services, we also have to think about social policy and economic policy and what the feds can do to make people's lives easier, because decreasing people's stress can decrease their risk of mental health problems.